I'm Dr. Alina Gerrie. I'm a hematologist at the British Columbia Cancer Centre in Vancouver, British Columbia, Canada, and assistant professor at the University of British Columbia. I focus my clinical and research practice on leukemias and lymphomas, specifically chronic lymphocytic leukemia, or CLL. CLL is a cancer of the immune system, and patients with CLL are known to have suppressed immune systems, making it harder for them to fight off infections such as bacteria and viruses. COVID-19 has been a particular challenge for patients who are immunosuppressed, and especially those with CLL, because they're at higher risk of more severe disease and they don't respond well to traditional vaccines. For that reason, patients with CLL are having a hard time getting on board with the changing guidelines. I think it's really important for patients with CLL to understand their particular environment or area where they live. What are the COVID rates like? What wave are they in? And what vaccines and treatment options are available? Because that's really key to navigating their particular situation. In Canada, and specifically in British Columbia, for example, all CLL patients are eligible for a fourth COVID-19 vaccination, which means a second booster after 2 initial doses. And so I encourage all my patients with CLL to get fully vaccinated, as even though they may not produce antibodies the same way as someone without CLL, we know that with repeated exposure to vaccines, their antibody levels will go up. It's also important to understand that treatment is available for COVID-19, which works best if taken within the first few days of having symptoms. So it's important for patients to be aware of that and to let their hematologist or oncologist know if they were to contract COVID-19, even if the symptoms are mild, as the whole point of these medications is to help prevent progression to more severe disease. It's also important to understand your region's public health recommendations and knowing that patients with CLL are at higher risk than the general population. So they may need to do a little bit over and above the current public health recommendations, especially as for the general population, things are backing off. But it always is an individual decision, and patients can make the decisions for themselves in terms of what measures to keep continuing with. For example, wearing masks. Of course, hand washing is very important, and staying away from people who are unwell. Consider CLL patients on World CLL Day.